Hello, everyone. We're going to give it a second, let everyone join the meeting, and then we'll get started. Okay, we'll give it one more second to let everyone in. Thank you for joining us today. All right, we'll go ahead and get going. So thank you for joining us for our media availability for today. My name is Heidi Bosk. I will be your moderator. And I should note that we have an ASL interpreter, Elijah, as well as cameras on for our presenters if you want to make any adjustments to your screens for recording purposes or viewing purposes. And with that, I'm going to take it over to the next slide. So joining us today, we have Dr. Eric France, Chief Medical Officer, CDPHE, Dr. Rachel Herlihy, State Epidemiologist, CDPHE, and Dr. John Samet, Dean of Colorado School of Public Health. And we're going to start with Dr. Herlihy to take you through some updated case numbers that we have for today.
Great, thank you, Heidi. So I'd like to start today with some of the basics. I'd like to start with some reminders about this virus. So the virus that causes COVID-19 is a member of the coronavirus family. This virus is called SARS-CoV-2, and the disease it causes is called COVID-19. The virus that causes COVID-19 is a novel or new virus, meaning it is a virus strain that wasn't identified in humans until 2019. And because it's novel, people don't have existing immunity to it. Right now, we think about 9% of Coloradans have been infected with COVID-19. That means the vast majority of people in our state are really still at risk. Like other coronavirus diseases, COVID-19 is a respiratory disease and is transmitted primarily through respiratory droplets that travel several feet when people cough or sneeze, or even when people talk, laugh, or sing. And that's really why keeping your distance from others about 6 feet and wearing a mask to stop those droplets is so important. Less commonly, the virus can travel farther than 6 feet in the air by even smaller respiratory droplets that we often call aerosols. That aerosol transmission, though less common, is why larger gatherings are risky. They can become potentially these super spreader events that we've heard so much about. Another less common route of transmission is through touching surfaces and then touching your mouth, nose, or eyes and introducing the virus that way. That is why frequent hand washing is so important in trying to prevent this virus. Next slide. So this figure shows you our case counts reported over time. So you can see that we have had 3 waves of illness: our spring wave, a July wave, and now a fall wave. At this point, we are at our highest case count since the beginning of the pandemic. In the last week, we have routinely seen 2,000 cases per day in the state. You'll see that the case counts look lower in the spring, and that is because we didn't have enough testing available at that time, but Colorado has been working hard to increase testing availability to capture more cases. And we want to keep that going because this information is really power to help mitigate the virus in the state. We want everyone who needs a test to get tested, and we advise that if you have been exposed to COVID-19 but don't have symptoms, get tested 7 days after exposure and quarantine for a full 14 days, regardless of the test result. If you have symptoms of COVID-19, get tested immediately. Next slide. We are also seeing a steep rise in COVID-19 hospitalizations with mounting pressure on our healthcare system in the state. Again, you see the 3 waves of illness reflected in the hospitalizations. We are almost at the same level of hospitalizations that we saw this spring, and with current transmission rates, we expect to exceed that level in the next 2 or 3 days. So one thing that the public can do to ensure hospital capacity isn't overrun is to get a flu shot. That'll help prevent flu-related hospitalizations, allowing hospitals to conserve resources. Next slide. This next figure shows you our positivity rate, or the percentage of tests that are coming back positive in the state. Tracking this helps us to know whether our case count is going up due to more testing. Unfortunately, that is not the case here. When our positivity rate goes up, when our testing is going up, means we really have more disease occurring. We want our positivity rate to be under 5% as an indicator of enough testing occurring in the state. We were really able to stay in that range from June until October. Unfortunately, in the last few weeks, our positivity rate has more than doubled. You'll see that 4 weeks ago, that rate was about 4%, and now that positivity rate is about 9%, and it does appear to be continuing to increase day over day here in the state. As I said before, testing is a key strategy for controlling this virus, and we really want people to take advantage of the more than 50 community testing sites that exist around the state right now. We also need Coloradans to do what they successfully did in the spring to flatten the curve. So wearing a mask, washing your hands, keeping your distance from others at least 6 feet at all times, and reducing the contact you have with people outside of your household. With that, I will hand it back to Heidi.
Great, so next slide, we're gonna go ahead and take it over to Dr. Samet to take you through some of our updated modeling data. Dr. Samet?
Okay, I'm going to take you through the most recent modeling data, which tells a picture that matches very much what Dr. Hurley just showed. This slide shows the hospital counts, which we use as the basis for our modeling to track how aggressively the epidemic is spreading in Colorado. We measure the effective reproductive number from this, and also, as I'll show you, the transmission control. So you see colored curves getting steeper and steeper as we go from the start of October through November. The effective reproductive number, very similar to the R naught, has risen across the month, and the most recent estimate is 1.66. Going with that, if you can just go through the automation, if you can click through, yeah, just go ahead and click on through down to now. We estimate a parameter called transmission control. If you can just go back to the prior slide. Great, thanks. Transmission control, very similar to the social distancing. And I'll give you a little bit of equivalence. Transmission control is of 62%, where we are now is about 50% on the social distancing scale we use. That was always a number where we knew the epidemic would propagate quite steeply. So you can see that the transmission control has dropped, and going with that, the effective reproductive number has risen. Go on to the next slide. What we're looking at here is in the tealish line, the blue line, the projection from last week's model. The current trajectory is in the sort of purplish line. And you can see that the actual data shown through today is departing. Sorry, well, yeah, I guess we don't have today's, but the number today is even a further departure from the line. So we are exceeding too quickly these trajectories as the epidemic propagates. So the curve is going up steeply, and perhaps even more steeply than what we estimated earlier in the week. Next slide. So there's important information here about what is happening across the different age groups in Colorado. So if you look to the left, transmission control by age group, what you'll see is transmission control is dropping in each age group, including those 65 plus, where it held pretty steady for quite a while. If you look at the case counts, at the case rates at the top right, you'll see there that the case rates are going up in all age groups very steeply early on in the 20 to 39-year-olds and continuing, but now in those 65 plus. And at the bottom right, you'll see that the counts of people in hospital are roughly the same in those 65 plus, just starting to outstrip those in 40 to 64-year-old age range. And then notice also that at the bottom and right, the red, the 20 to 39-year-old count in the hospital is going up too. So I think important points here. It's not just older people who are in the hospital, younger people are in the hospital, middle-aged people are in the hospital. And in particular, the rise of the rate of infection among those who are older is concerning. Going with that, the drop in transmission control in that age group. Next. So now just to say some what if scenarios. So this provides projections, things that could happen if we stay on the same trajectory, this 62% transmission control, or R equals 1.66. You can see the real data in black. The dashed line is 1,800, a number that we've taken to represent a potential critical care capacity for people ill with COVID-19. So you can see we would go over that number if we stay on this trajectory. We have the holidays coming. We can click the next. We have holidays coming where we expect people will get together. There'll be more mixing, perhaps some lapsing in how carefully we are doing transmission control. So we've said, what if there were a relative drop in transmission control of 10%? Well, then we have that green line. And you can see it more steeply goes up. And you can also see that it reaches a higher peak than the 62% line. And then the next, just click again, is the 20% relative change. So again, this looks even worse because we have less transmission control as we head into the holidays. So looking at this slide, we're heading into the holidays on a steep curve. If we follow past behavior at the holidays where we get together, we travel, this could make the situation even worse, the green curve and the brown curve. Next. We've also taken a look around the state at how the epidemic is progressing. So this is a map of the R values across time and for different local public health regions across the state. You can see that we started high, of course, then the lines turned blue as the infection came under control. But if you look now, there's different levels of R across the state, but almost all the regions are moving into the red colors, signaling that R is above 1 in our regions across the state, although at varied intensities. Next. So just a few key messages from the models. So I think all the data support that the epidemic is worsening. In Colorado, we have colder weather and more time indoors and other potential explanations. The concerning rise of infections and hospitalizations among older people. And then this really important combination of coming into the holidays with the rising epidemic curve, combining with the kinds of things that we'd like to do at holidays, get together with family and friends, and the travel. So holiday travel will be more risky as a result. And, again, certainly consider whether you need to travel or can reduce travel. Contacts among people who are not in the same households should be minimized. That's how part of how we know that infection is transmitted. And then I think we really need to take heed of the rising infection rates among older people and look to ways to protect older family members and friends as we head into the holiday season. It's time when we all like to get together, but this is not our usual holiday season. So I think with that, Heidi, I'll turn things back to you.
Yes, thank you for sharing that with us. Now we're going to go ahead and take it over to the next slide and Dr. France.
Thank you, Heidi. So today we've heard some really worrisome news. We've heard from Dr. Hurley that in the next couple of days, our hospitalization rates will be back up to where they were in April. We heard the worry from Dr. Samet that these rates of disease are going up, becoming more and more steep. And we've heard that we've got to think about what we're doing in the holiday season, because if we keep spreading this virus, it's going to be a very, very serious time for our state. What's unique about this virus, of course, is that so many of the people who are sick with it don't have any symptoms. And so they walk around and potentially spread it to others. Or like other respiratory viruses, you might feel fine today, but you're destined tomorrow to feel sick. And today you're at a spot where you're walking around and spreading the virus, because the days right before your symptoms begin are days where you're maximally spreading the virus. So this is our challenge. How do we not spread this virus? Well, we've been just talking about all these actions that we can do, in particular to help us for those who are not with symptoms or pre-symptomatic. We need to avoid in-person gatherings. We need to stay home when we're sick. We need to be sure we're making appropriate physical distancing, washing our hands, wearing our masks. And of course, most recently, we can sign up for exposure notifications on our phones so that we're individually notified if we were around somebody for 10 or 15 minutes who turned out to have COVID, and can then take the next steps to isolate or quarantine ourselves. Anyone who may have been exposed to the virus but does not have symptoms should get tested 7 days after the suspected exposure. And if you are exposed, you need to quarantine for a full 2 weeks, 14 days, regardless of your test results. If you do go on to develop symptoms, what's different here is that we want you to quickly get tested. In times past, if you had a cold, you'd stay home, but now it's not enough to stay home. You must also be tested. Next slide. I want to remind you too, the difference between isolation and quarantine. Isolation is what we do when we're ill. The two words start with the letter I. And when you isolate, you have to stay home for 10 days since your symptoms first appeared. And you don't go back to work or out in public again until you've been at least a day without fever, off of any medicines that might reduce your fevers, and that your general symptoms are improving. So this is what it looks like to isolate. If you've been exposed to somebody, you need to stay home for 14 days because the symptoms can develop anytime in that 14-day period. Next slide. What are we going to do? Well, certainly there are these individual approaches that we all know of wearing masks, distancing, but at the local level, we have empowered counties and leaders to take action to try and reduce the spread of this terrible virus. You're all familiar with our dial as a way of really being sure each county, each area is protecting itself based on the level of disease in that community. At the Protect Our Neighbor, we are considered most open. And of course, at the far side, we're at Stay at Home, where we all stay and do not go out so that we can minimize the spread of the virus. When this dial was first set up, the yellow level was kind of where we were beginning. It was our baseline with 50% seating at restaurants and churches. So we had closed things off, but at the same time recognized that you could be more open. You could move to the blue level and the green level if the disease rates were low, if your positivity rate was low, if your hospitalizations were stable or decreasing. Unfortunately, today we're at a place where more and more of our counties are moving into the orange or the red levels, where the incidence rates in their counties are high, requiring them to shut down even more. Adams County, Denver County are currently at the orange level, the high risk level. And for them, the next step is stay at home. And so the expectation is that the leaders in these counties at level 3 will do as much as they possibly can to avoid staying at home, and may very well go beyond the requirements of level 3 orange, of reducing to 25% capacity at restaurants and churches and at office spaces that are non-essential, for example. I think over the next days, we'll hear about more counties being moved closer to the stay-at-home, further to the right on the dial, given the high rates of disease that we're seeing. I think today there are at least 18 counties that have incidence rates that are putting them at the stay-at-home level. And so we'll be working at the state closely with a number of counties to learn about their plans and expect to see them to implement plans over the next days so that we can control this virus spread. So while counties are doing this work, we too, as individuals, as Coloradans, need to personally do our part by taking the precautions that we had in place last April. We need to avoid travel that's unnecessary. We need to work at home as much as possible. We need to stay inside if we're vulnerable. Next slide, please. We're happy to announce today that we've launched our data and our dial informations now in Spanish, as well as English at our websites. We think it's very important that we're transparent with the information that we get every day. I know this is where I go to find my source of information for each day's performance, for how we're moving on hospitalizations, cases, and positivity rates, and to understand where each of our counties are on the dial. I would recommend each of us understand and look to this data to see where we are at the county level on our dials. We should be asking our county leaders about what our approaches are going to be so that we can move backwards, so that we can control this virus as it has been increasing in our state. Next slide, please. I'll turn it back to Heidi. Thank you.
Yes, thank you, Dr. France. And so now we'll take it over to the Q&A portion of our presentation. What we would like you to do is use the raise hand function, and I will call on you. And if you could say your name and which outlet you're with, and then go ahead and ask your question. Chris, I'm going to start with you.
Chris Van Intervene with 9 News. Can you guys hear me okay?
Yes.
I have two questions. My first question is have we considered the possibility that anything else is going on here in terms of assisting the rate of spread that goes beyond just sort of compliance with the with some of the regulations, that sort of the social distancing and that type of thing? So first question is there anything else that you're considering that could be potentially going on in terms of assisting the rate of spread? And the second question is, are we starting to seriously consider what was once unthinkable about a month or two ago, sort of the implementation of those stay-at-home orders for individual counties? You mentioned as many as 18 counties maybe having the case thresholds that would meet that. Is that now back on the table? Is the stay-at-home order now back on the table?
Rachel, do you want to start with thoughts on what might be explaining the spread, if there's anything else we should be thinking about, and then I can answer around the stay-at-home question.
Yes, so as far as the question about why we are seeing more disease transmission now, it's likely not a single factor. It's probably multifactorial. We do know that this virus spreads much more efficiently in indoor environments. We know with lots of respiratory viruses, there are seasonal components. And so I think it's quite possible that we could be seeing some seasonality associated with this virus. I think that potentially could mean that, the efforts that were successful in the state in the spring and in the summer may be a little bit more difficult to achieve as we move into the winter and the seasonal period for respiratory viruses and more people indoors. It might be a little bit more difficult to control this virus. And I think that really means that we need to double down on the strategies that we know work to control this virus. So all of the things that we reviewed today, all of those strategies, social distancing, limiting your actions with other households, all of those factors are going to be even more important now than they were in the spring.
regarding our potential, looking at the dial and what it means, certainly the dial is there to encourage local counties to own and move on control when they're moving towards stay at home. Nobody wants to be at stay at home. And so the question therefore is, what can we do all the way up to, but not crossing over into stay at home? Would curfews be something to consider? Would be reducing any events that bring people together in gatherings be something to consider? I would expect that local counties leaders will start thinking about how close can we get? What are all the things we know that may work that we should be putting in place so that we don't cross over to stay at home? Because stay at home is real and it's an option. As you know, with the dial, it all begins when a county moves into a measure that is no longer in their current state. They have too high of an incidence rate. Their positivity rates are too high. And that begins a conversation with the state health department. And over the next 2 weeks, there's an expectation that those counties are making moves to clamp things down so that the virus doesn't spread. There's a revisit at that point, and if things aren't moving or if they don't seem to be taking this seriously, then the state then has the option to consider moving people to stay at home. And as long as these rates are going high, that will unfortunately be a real option.
Great, thank you. Jessica, we're going to take it over to you. If you could say your name and the outlet that you were with.
Hi, it's Jessica Seaman with the Denver Post. Can you tell us if there are any hospitals that are already at capacity, especially in the mountain and rural areas?
I can start, though I don't unfortunately have the answer to that question right now. I'm not certain. I do know that, there is a lot of movement from hour to hour in hospitals in the state. I don't know, Dr. France, if you have any additional information.
I think it's as Rachel says, in that hospital capacity can change from hour to hour, and there is the capacity for patients to even be moved from one hospital to another. The capacity of the hospital, of course, is driven by COVID. It's also driven by an acute appendicitis, a car wreck that requires trauma care, a heart attack, or a stroke. And the hospitals are quite full these days from a mixture of both COVID and traditional acute care needs. As a matter of fact, we should all be worried that when hospitals are filled with COVID, that means I may be at risk even if I'm staying at home, because I may have a heart attack or I may have a car accident that requires hospitalization, and the hospital might be near full. There may be delays in care. So we're all impacted by full hospitals, whether or not we have COVID or not. We've worked closely with the Colorado Hospital Association this last year. The hospitals are very good at being able to monitor their capacities and potentially delay certain kinds of surgical procedures when possible if they need to keep beds open. And that close relationship means that they'll continue to monitor and manage patients so that we aren't overwhelmed in the short term. It's the weeks more around Thanksgiving and beyond where now we're starting to be potentially concerned that COVID cases plus our traditional hospitalizations may overwhelm our staff and our beds.
Great, thank you. Taylor, I'm going to take it over to you. If you could say which outlet you're with.
Yes, Taylor Summers for NBC News Radio. Oklahoma just confirmed today they have more than 1,000 hospitalizations for COVID-19. I was curious as to how hospitalization rates like that in neighboring states, how that puts a strain potentially on our own healthcare system, as we could be potentially asked to help with surges from our neighbors.
I I'd say it's certainly a factor. We've already, over the last weeks, been asked to help with hospitals in Montana where their rates have been quite high. Sometimes it's a question of PPE, personal protective equipment. Could we share with them material? I'm not aware of a large number of patients transferred to Colorado at this time, though you can imagine in our surrounding states, they're somewhat more less populated, that fewer hospitals overall, and they may look to a state like Colorado for help in the near future.
Great, thank you. Vinny, I'm going to take it over to you, and if you could say which outlet you're with.
Hi, it's Vinny Del Giudice at Bloomberg News in Denver. How do you assess Pueblo's decision to institute a 2-week overnight curfew to fight COVID? And do you know of other communities that are considering curfews? Thank you.
Well, how can we get as close to stay at home without actually declaring stay at home in a given county? During the stay at home period of end of March into April, we were essentially in curfew. We were staying in our homes rather than going to restaurants or movies in the evenings. And so a curfew seems like an important tool that could be used by a local community to reduce gatherings, reduce contacts, and improve social distancing. So Pueblo made the decision to use this tool. I would not be surprised if other counties, as they're in the level 3 approaching stay at home and still seeing numbers go up, will say, look, we need to do more. We're going to need to think about doing curfews. So I would not be surprised in the next weeks if we see more of that in our state.
Great, thank you. Aaron, I'm going to take it over to you if you could say which outlet you're with.
Okay, can you guys hear me now?
Oh, yes, we can hear you now.
Sorry, I was talking with no one listening, apparently. This is Erin Prater with the Gazette in Colorado Springs. I know there was a new public health order earlier this week that I believe declared schools to be essential businesses. In the Pikes Peak region, there seems to be a lot of talk from superintendents about schools being safe, about transmission not occurring in schools. I just wanted to know if you guys are finding this to be the case and if you have data to support this assertion that schools are a safer place to be for kids than out and about in the community, and that transmission, while it's occurring elsewhere and then these positive kids or staffers are coming to school, is not occurring in schools. Thank you.
This is Rachel. I can talk a little bit about some of our state level school data. So I think one important thing to know is that transmission in schools and transmission among children really varies by age group. We see a big difference between elementary schools and high schools. So specifically, if you look at transmission in our younger students, the case numbers when we see outbreaks occurring in schools are smaller. We're more likely to see staff that are involved in those outbreaks. But the story is pretty different when you look at our high school students. There we do see more students involved in the outbreaks. We see larger numbers of cases associated with those outbreaks. As I mentioned, there are fewer staff cases than associated with those types of outbreaks. So the transmission dynamics, I think, are a little bit different depending on the school environment that you're talking about. One of the things that I would note is that, in the last few weeks, we certainly have seen an increase in outbreaks occurring in schools, but I do think some of that does also reflect the level of community transmission that's occurring. So certainly students can be exposed outside of school and bring that infection to school, but they can also, I think, be infected in the school setting. I would say that's more likely, it's from our data at least, to seem to occur in the high school setting versus younger school settings.
Great, thank you. Connor, I'm going to take it over to you if you could say which outlet you're with.
Hi, yeah, Connor McHugh with CBS 4 here. Is there any concern whether our testing capacity can keep up with this rise in community spread we're seeing? We've seen a few facilities reach capacity pretty early in the day the last few days.
So yes, we are certainly, we're concerned about capacity at all levels, right? So we're concerned about our public health capacity, our healthcare capacity, and that does include our testing capacity. And so we have been working diligently in the state to really improve access to testing across the state. We are working to make sure that we have really turned over every stone we can to find testing resources. And we're really looking to multiple testing modalities. So the PCR tests plus the antigen tests as ways to really improve our situational awareness and our public health interventions here in the state. But certainly testing capacity, like all capacity, is a concern as we see more and more cases occurring in the state.
Great, thank you. Ray, I'm going to take it over to you, and if you could say what outlet you're with.
Hey, this is Ray Ellen Bichelle with KHN, Kaiser Health News. I'm really interested in countries, and I think some Canadian provinces too, that in dealing with sort of similar situations have made it part of their official public health orders and policies. They're telling people how to form quarantines or pandemic pods. Basically, you pick another household or two and you interact with them and only them. Can you talk about whether that's been discussed, and if so, why it doesn't seem like a good way to go in Colorado? It just seems particularly relevant now with holidays coming up.
Yeah, this is Rachel. I can start and then others can jump in. So I think that actually is a strategy that we are using and recommending in the state. So if you look at some of the guidance in the public health order, you'll see recommendations around gatherings of no more than 10 individuals, and that should include no more than 2 households. So certainly limiting the number of households that you have contact with is a really important strategy. We know that the greatest risk of transmission appears to be within households. And so really limiting the number of contacts that occur between different households is a really important strategy to prevent spread in one household from getting to another. So I would say it actually is a strategy that we're using perhaps a little bit differently, or we're talking about it a little bit differently than some of those Canadian provinces you mentioned. But I absolutely agree that is critical, and that's an important way to prevent transmission from house to house.
It is. Oh, sorry. It is a very different thing, though. I mean, to say no more than 2 households can gather together, that means my household could interact with 7 different households. Mm-hmm. You know, 1 different household per gathering per day of the week. That's a very different thing than saying interact with, pick 1 or 2 households you're going to be exclusive with. Is that something that has been discussed?
I think it's certainly clear that the idea of creating a bubble, not only your family, but if you have close friends who they've kept themselves safe, distant, acting appropriately, then merging into one bubble and doing things together can be both therapeutic, it can be very rewarding. And so it's an important message that we should be sharing. I think on the converse side, on the back side of it, it also suggests that if you're getting together with someone where you're not really sure about how safe their family activities are, then that's a risk. And so that poses maybe a particular challenge when you think about the holidays, the Thanksgiving coming up, families coming together when there could be variation across our families even on behaviors. And so it would be important for us all to stick with the principle, I'm okay to meet with this part of my family or another family if we both assure ourselves that we are not doing a lot of interactions in the last 2 weeks. And if it turns out this other part of my family is out and about and potentially behaving in a way that puts them at risk, I need to have the strength and fortitude to say, look, I can't meet with you, I can't be with you over the Thanksgiving holidays this year.
Great, thank you. Amber, we're going to take it to you, and if you could say which outlet that you are with.
Hey there, it's Amber Jo Cooper at Fox 21 News in Colorado Springs. We just found out that our jail here has over 600 cases, not including staff. So we're wondering, are those positive cases in jails weighted differently because they're separated from the rest of the community? Are we going to be seeing those numbers reflected in our case numbers? And how does this affect the data?
I can start with that question. So I think it depends on how you're counting the numbers, right? There's different ways to count cases. In terms of the dial and a county's position on the dial, we do state that cases occurring among residents of residential facilities are not really included in the case counts for moving that county's position on the dial. And the rationale there is that those individuals, so individuals who are in a jail or a prison, or actually even residents of long-term care facilities that are not leaving that facility, are generally not contributing to community level transmission. And so they are not out about in the community, potentially spreading virus to others. The exception would be, of course, though, individuals that work in those facilities. So those cases among staff at those facilities where those staff go home at night, they go to the grocery store, those sorts of things, those cases would be contributing to community level transmission and then are calculated in the dial. So I think it just depends on how you're counting the numbers and for what purpose.
Great, thank you. Michael, I'm going to take it over to you, and if you could say which outlet you were with.
Thank you. Michael Booth, writing for the Colorado Sun. First question would be about testing capacity. Do you want cities like Denver to reopen more mass facilities such as Pepsi Center as they had for a while? And second, could you go into more detail on the 18 counties who you said are either moving very close to or already into stay-at-home territory in terms of case levels? Who are they? And besides curfews, what other methods might they have that you would recommend for them to start getting control?
Hi, Michael. Thanks for the question. I can start maybe with your second part of the question about who are they. And I'd encourage you to go to the website, and it's the Dial dashboard website at CDPHE. And if you were to click on the button that asks for the 2-week incidence of cases across the counties, you'll see that I think by my count, there might have been 19 that were actually red, and maybe another 19 or 20 that were orange. So those are the level 3 and potential stay-at-home level of 2-week incidence of cases. And so each of those is in conversation with the Colorado Department of Public Health and Environment to work on what are their interventions going to look like in order to reduce those incidence rates. And while being at a level 3 says that you can only use 25% of the capacity for non-essential offices, churches, restaurants, and so on, there's nothing that says any one of those counties can't do more. They could choose to put in a curfew. They could choose to eliminate sports events, public gatherings. Each of them has their own choice about how they want to do that, which is, of course, the principle of that local control. The state will then listen, learn, and watch with them over their subsequent days to weeks. And if the numbers aren't improving, the state will move them into stay at home. So I think as you should go speak to the different leaders in those counties, asking them, what are you doing? What is your plan? How are you going to get these numbers down? And why do you think those actions are necessary to move those numbers down? You'll get a story that may differ by county as to what they want to do. And regarding the testing sites, let me just ask Rachel if you have anything you would add about whether we're thinking about any expanded testing.
I don't. I mean, I think I would just point out that testing capacity refers to both capacity to collect specimens, but then also the laboratory capacity to perform that testing in the lab. So I think that there's sort of different questions about capacity, and I don't have the specifics about, regional or local ability to collect specimens by location right now.
Great, thank you. Jennifer, I'm going to take it over to you if you could say which outlet that you're with.
Yes, thank you. Jennifer Kovaleski with Denver 7, kind of following up on the last question, but you mentioned how can we get as close to stay at home without crossing over? Outside of curfews, what other tools do you see as key to slowing the spread that these local communities could start implementing?
This is Rachel. I can take that, and others can weigh in. So as I mentioned earlier, we certainly know that mixing of households and gatherings are situations where we see disease transmission occurring, especially thinking about the holidays coming up. We know that having gatherings around the holidays, that's a scenario where we've seen increased disease transmission with other holidays. So specifically with the 4th of July and Labor Day, we did see increased transmission that occurred around the holidays. And so I think that is going to be a really important strategy over the next couple of months, is limiting the number of individuals that are gathering together and the number of households that are mixing with each other, knowing that socialization is really, I think, a driver of disease transmission.
Maybe this is John Salmon, maybe a couple of comments. I mean, I think what we need to do is have measures in place, whether they are policy measures or they relate to behavior on the part of all of us that will lower transmission. We need to head to a level where the R number is back to 1 or below 1, or the curve continues to rise. So I think we know where we need to go. And I think Dr. Hurley already mentioned one key factor, going indoors, both in terms of more contact, perhaps greater concentrations of virus in the air, and perhaps the virus likes cold weather. And that's another possibility, one we don't understand, but we know that some do. I think looking at what's going on across the state, I think many of us talk about COVID fatigue in different aspects of our life, but I think one critical part of that is just a tiredness of contending with all that we need to do. And perhaps there's a general lapse. I mean, we see this drop in transmission control at all ages. So I think we need a combination of doing better as individuals, coupled with some of the policy options we've talked. But to get R back to where it needs to be, it's not going to be just one thing. It's going to have to be a combination of the right factors.
I would just add that, of course, the goal is to avoid stay at home. That's really what we're all working towards. And we aren't powerless in that effort. We each can do a lot to help us stay out of that scenario. We think about what was it like in April when I was at home. How can I mimic that? How can I stay home in the evenings? How can I make sure I'm keeping distance? How do I shop safely for my groceries? What do I have deliver? We each have the power to do the work so that we don't fall into the stay-at-home scenario.
Great, thank you. And I think, Vinny, if you don't mind, I'm going to jump over and let John ask his question, since you did get to ask one before. So John, I'm going to go ahead and take it over to you.
Great, thanks. This is John Ingold from the Colorado Sun. I wanted to ask about deaths. We're seeing deaths increase again, but we're not seeing them at or anywhere approaching the level that we saw in spring, which is good news, obviously. But the argument that we end up hearing a lot out in the community is that if deaths aren't increasing at rapid levels, then maybe these restrictions that we're adding on aren't necessary. And I'm wondering what you think of that argument, and to what extent you believe the survivability rates that we've seen in the last couple months, or if those are sustainable as cases and hospitalizations continue to rise higher.
So, this is John Savitt. I'll make one comment. This is more than survivability. I mean, I think we're learning that there are lasting long-term consequences of having severe COVID-19. So I wouldn't take mortality by any means as a single marker for the impact. I think as time goes on, I think we'll get a broader appreciation, in fact, what it may mean to have had COVID-19 for longer run health. I will say that we've incorporated the improving survival into our models. It seems that we are doing better with respiratory care, and perhaps in particular dexamethasone is making a difference. But this is a severe disease with severe outcomes, and it's good that we were able to lower the case fatality rate, but I think we have a lot to learn about long-term consequences.
This is Rachel. I would just echo what Dr. Samet said, and I would also caution interpretation of the death data because that data lags quite a bit. So I think we are really just now starting to see an increase in deaths associated with this fall wave of illness. And I think, unfortunately, we're going to see many more deaths over the next couple of weeks as some of that data catches up with our case data.
And it's important not only to think about all we don't know about COVID, that 1 in 4 people with COVID seem to have some involvement of their heart, that they have involvement of lungs in ways we hadn't seen before. And what does that mean for the 35-year-old who's been sick with COVID over the next 10 years? We also have to think about the person who has a heart attack destined in a week and arriving to a hospital that might be overrun by patients who have COVID makes it more difficult for the staff to take care of that general heart attack patients. So while there's this growing sense of maybe it's not as severe, there's still lots of implications of having a hospital filled with COVID patients, making it more difficult for our staff to take care of the everyday and the unknown around what the long-term effects of these COVID illnesses might be.
Great, thank you. And so with that, we do have to wrap up for today. If you did have a question that we didn't get a chance to answer, please send it to media_info@state.co.us. And I want to thank our participants, Dr. Eric France, Dr. Rachel Herlihy, Dr. John Samet, and Elijah, our ASL interpreter. And I hope you all have a lovely afternoon. Again, if you have any additional questions, please send those to media_info@state.co.us.